So just introducing our education session with Pia, talking about the different types of data beyond health data that are out there and what her and the research team are doing with them. Pia, I'll let you get on with that, and off you go.
Great, thank you so much, Chris, and thanks also to Emily for organising this. And I'm so excited to be here to chat to you today. I'm going to chat about a data resource that we are currently setting up, and it's called the Kids Environment Health Cohort. So I'm an epidemiologist at University College London Institute of Child Health, and Alistair Baird could also be here on the call today. He's a research fellow who's working with me on this project. So first, I'll talk to you about the project, and I'm really excited to hear about what you think and, chat to you about it. And then we have Samina here as well, who's from Born in Bradford, another cohort, very important cohort, and she's going to talk for about 5 minutes at the end, I think, about her work and her involvement in Born in Bradford. So our project and the data resource we're setting up is called the Kids Environment Health Cohort. And so first of all, I just wanted to talk to you a little bit about what we mean. I hope you can see my slides okay, otherwise you just shout at me. But we just want to talk to you a little bit about what we mean by environment in this cohort and the data we will be using. So of course we mean both the outdoor physical environment, so that could be things like air quality, access to green spaces and blue spaces, whether you live near a road, and how hot or cold it is outside. But it can also mean environment in the home. So how is the home heated, which has implications for obviously how hot or cold it is in the home, but also for indoor air pollution, and is the home well ventilated. And so so these, I think, this is a mine here as well. So do you live near a mine? Obviously fracking is a very politically challenging issue. So that's the physical environment, but we're also interested in data about the social environment and its impact on health. So that could be like what the food environment is in the local area. Is mainly fast food restaurants, the supermarkets, the fruit and vegetable markets, so it's easier to get hold of relatively cheap healthy food. Are there gambling outlets near where you live or where children might go to school? Are there services like childcare facilities and libraries? And we know from some other public engagement work that we've done that particularly parents who have very young babies, they find it very important to have sort of social and community support, and a lot of that is provided through libraries. So we have a very broad definition of environment, and I'll talk to you a little bit, and obviously getting data about these things, some of them are easier. So for example, childcare providers are available by Ofsted. Some of them, like food outlets, are more tricky to get hold of, but so that's the sort of data about the environment, the different types of environment data that we're interested in. And why are we interested in this topic in the first place? So I think during the pandemic, unless we might very well have already been aware about the impacts of our environment and our health, but I think during the pandemic and during the pandemic lockdowns, I think it became extremely evident to everyone how important both our indoor and our outdoor environment in our local area, because we couldn't travel, how important that was for our health and and our well-being. Of course, we're living through a climate crisis. We had a massive heat wave last summer, so we have increasing temperatures. We have an energy crisis at the moment, and then so that's really going to affect both our indoor and our outdoor environments. But of course, we've also had, not going to get into too political, we've had years of austerity that have changed how the services that are available to us in the local area, such as childcare services, and there have also been sort of changes to libraries and local authority services, but also the way that we shop, for example, has changed our high streets. So I think this topic of how our local environment, indoor and outdoor environment, affects the health has never been more clear to people. So these are all news headlines. They're mostly from the last 6 months, but some of them are a little bit older. And then so the government is obviously responding to this, both local government and central government. And we can think that perhaps they should be doing more in certain areas or not, but they are responding. So we have a new Environment Act, which was particularly controversial to do with the sewage and how much was allowed to be released. There's a Building Safety Act. There's help people can get with their energy bills now in this energy crisis. We have various policies to improve active travel and change planning, and also to improve air quality. So we also need to know whether these policies are really working to improve child health and education, which is what we're focusing on. So then why are we focusing on children? So I'm a child health expert, that's what I do, but children are much more vulnerable than adults to the health damaging effects of or potentially health damaging or health promoting, more receptive to health promotion in the local environment than adults. So children, particularly smaller children, their lungs are still developing, their immune systems are developing. They are therefore much more vulnerable to certain chemical exposures and air quality and air pollution exposures in early life than adults are. And of course, we know already that growing up in a healthy environment, which includes your local area, has lifelong health and education implications that can really improve your health if you have a healthy early life. And so, I've said this already, but we think it's more important now than ever to study how the local environment in and around children's homes and also around where they go to school, it affects the health, because there's obviously, we're living through climate change, all of these things I've already said. So we have been funded by Administrative Data Research UK, which you may or may not have heard of. I hope you probably have heard of it. But if not, I'm happy to explain more about it. So that's part of the Economic and Social Research Council, and we've been funding to set up this new database that can be used to study these effects. And so these are some of the example research questions that we are focusing, is that could be used to answer, that this cohort or database could be used to answer. So for example, how does living near parks, fields, other green spaces impact children and young people's mental health? And what's the impact of living near good quality childcare providers and like childminders and nurseries on children's school readiness? And does being born after periods of high air pollution and heat impact your health and education as you grow up? So those are the type of research questions that we expect this cohort to be able to answer. I should just say that the cohort that we're developing is it only focuses on England. So you may or may not have heard of SAIL in Wales, and that massive data that covers the whole Welsh population. They've really been a front runner in this area of linking environmental data to health data. And so really what we are trying to develop for children is what's been possible to do in Wales for many years, but this database, so we're trying to do what they've been doing for children in England now. And we're working with Wales as well, so because they're sort of experts in this. So this is the cohort then. So the basis of the cohort will be birth records that are held by the Office for National Statistics, and the birth records will be linked to birth notifications, which is what gives children the NHS number, and there are certain really important variables that are collected on birth notifications, like gestational age and ethnicity. So the birth record will be the basis, and we will include both live born and stillborn children to be able to look at stillbirth and environmental impacts on stillbirth. Then the children, the live born children, their birth records will be linked to hospital records, so hospital episode statistics, community dispensed medicine data, community mental health data, and also to their state school education records, because we think for children that education and health are so extremely tightly linked that it's very important to link to education records as well. And also you might want to look at things like, how does exposure to air pollution affect your school grades and your school performance, school readiness, etc. So that's why we're also linking to education data. And then the birth registrations, they will be linked to the maternal hospital records for the mother for a year before birth, so that we can look at any conditions the mother had that might affect the child's health and take them into account. And the mother, certain children born in particular years around the 2011 and 2021 census, so a year before to a year after those two census dates, their mothers, they will be linked to the mother census records, so we can find out more about socioeconomic status for those children, because we know that if you're a child growing up in a poor family, you're much more likely to be exposed to adverse environmental conditions. And so we think it's really important to, at least for some of the children, have individual family level information about, for example, parental education and things like that, so that we can take that into account and compare that to other measures, area level measures of poverty that we'll be including. So that's the sort of data about the children. And then what's really unique about this database is that we will request NHS Digital to link their children to their longitudinal NHS address records, so that we know, there will be data. We as researchers won't know where the children live, but there will be data about which addresses the children have lived at, so that it will be possible to link in the environmental data. So if there's environmental data on air pollution, for example, that's quite frequently modelled at a 100 by 100 metre grid. And so if we know the address, it will then be possible to link that very specific air pollution data to the child's address. So we won't have to aggregate air pollution data up to, for example, a local authority level or something like that. It would be possible to have very, very sort of detailed environmental exposures close to where the child lives. Via the Department for Education and the education data, we will be linking to longitudinal, so GIAS data is getting information about schools data, and that's a database that's available online, and it has information about school locations. So it will be possible to link in information about the environment around the school as well. So for example, how green it is near the school, are there very busy roads near the school, etc. So both where the child lives and where they go to school. So that's the sort of structure of this database. I should also say that the NHS address records will also be linked to the mother a year before birth, so that it's possible to look at, for example, air pollution exposures during pregnancy, etc. So that's sort of the structure of the cohort. And who will be in this cohort then? So we expect the cohort to include data from all children born in England since 2006. So that's around 10.5 million children. So why are we looking to include all children? It means it will be possible to estimate small effects. Some of these environmental effects on health are quite small, but they could be important because perhaps all children in a particular area like London are exposed to them. So there could be, the public health impact could be huge, even though the increase in risk is quite small. It's unique in this cohort because England has such a big population, is that we'll be able to look at environmental impacts on high risk groups of children. So for example, children who are born prematurely, children with long-term conditions, they are likely to be far more vulnerable to some of these environmental impacts. And so we need to be able to sort of estimate that for these cohorts. And that's why I think England is one of the few countries in Europe that have these data, and where we'll be able to do that. And importantly, because we have the whole country, we'll be able to look at how environments the children are growing up in vary across England, and how it's all changing over time. So I should say, which you're probably aware of, so we're asking for, we'll be linking these data for 10.5 million children. We're not going to ask for consent, so that would be impossible given the resource constraints, and it would be extremely expensive, and also the people who would respond, because particularly people with children, they live very busy lives, teenagers live very busy lives. The people who would respond would be very different to the people who don't respond, and so the results would be virtually impossible to interpret because they would be so biased. So instead of consent, we are relying on certain other legal bases for linking data. So that's the section 251, which is under the Health and Care Act, to link and process the health data. And for linking the census data and birth registration data, we're relying on the Digital Economy Act, which is how the ONS does a lot of their linkage. But I'm happy to discuss that more as well. So what we think is that this national cohort as well will really complement what's been done in Sale in Wales. So because England is a very different country in terms of the makeup of its population, the size of its population, but also how the environment's very different. Wales is very green, and a lot of England is not very green. So that's one thing. We also think that this national study will really complement other studies that you may have heard of. So you're going to hear Samina talk about Born in Bradford at the end. So that's a local cohort in Bradford. But also other UK cohort studies that you may have heard of, where they select a sample of children and follow them up, sometimes quite constrained in an area. So one example is ALSPAC, and another one is the Millennium Cohort Study. So we think that this, they have obviously much more detailed data about health because it's questionnaire data, but they only have a sample of children, whereas we will have everyone. So we think we're working very closely with some of those studies to see how this could complement, but I think it would complement it very well. Okay, so sorry, I feel like I'm talking too much. So who will link the data? So NHS Digital will link the health data, the Office for National Statistics will link the vital statistics and census data, and the Department for Education will extract the education data. NHS Digital will also link the health and education data because they already have a link there that's been done for another study. The address, I said there would be address data. Office for National Statistics will hold that will not be made available to researchers at all, because clearly it's highly identifiable. So Office for National Statistics will hold that separately to all the other data in the cohort. And all the data that's going to be made available to researchers will be made available in the Office for National Statistics Secure Research Service, which is the national trusted research environment. I think it's one of the oldest ones, has been around for ages, and ONS are doing a lot of improvements to it now. And so what we're working with ONS now, the idea is that researchers would be able to, they will hold the environmental data. We will link in some environmental data that has already been processed for this, but researchers might hold environmental data on access to food outlets, biodiversity indicators, whatever you like, that's been mapped, that can be mapped to an address, and then they will have to be encrypted before they are brought in to link to the cohort data, and likewise the cohort addresses will be encrypted so that there will be no way of actually working out where a child lives. We will also restrict quite a lot of the variables that we're requesting from example from hospital episode statistics, so it won't be possible to know which hospital the child went to, because again that can be quite identifiable, right? So we're going to try and restrict a lot of the variables available, but obviously still making sure that you can do the research, but a lot of the geographical data from those health data sets won't be available. Let's see, yeah, so how are the data kept secure? So ONS have a policy that anything in the Secure Research Service is de-identified. So there will be no identifiers, there will be no dates of birth, it would be week of birth or something like that. So that that's very clear. So researchers can't see addresses, dates of birth. And we won't know who the people in the children in the cohort are. As I already said, about the data will be kept on ONS servers, and ONS have a very strict training policy. You have to be an approved researcher with ONS, so you have to have shown that you have to pass a test, so you're not going to try and identify people, extract data, etc. All the projects, because we want to make this resource so that researchers can use it, so that it will be widely used by researchers, but all the project proposals have to be reviewed by a committee to ensure that they actually look at this topic and nothing else. And the committee is called the Research Accreditation Panel, that has some lay members on it. I'm actually meeting with them on Monday to discuss further about their membership, and whether I don't know whether they're planning to expand it either, but I'm meeting them on Monday to talk about that, because clearly people like NHS Digital, ONS, they all want lay members on it. We do too. So we want sort of not just academics reviewing the proposals, and all anything that gets exported from this server where the data will be held, that is checked by people at the Office for National Statistics. So there can be no sort of there won't be any sort of, people aren't trying to extract data sets with individual level data, or there's small numbers in tables and things like that. That's all checked. And you can only access this data in very secure environments that have been pre-approved by ONS. So you can't just sit at your desk in your workplace or in a cafe and act as it has to be. It's very strict rules about it. And so finally, I want to talk a little bit about the engagement we're doing, because clearly we want to talk a lot to people about what we're doing. So first of all, we're meeting with this existing groups like yourselves to talk about the project and chat to you and hear about if you have any concerns or questions. We have a graphic designer who's working with us to develop an identity, so we'll have a website. We are going to develop YouTube videos. We're going to get an Instagram account, and so we're going to try and have a very sort of active presence online. We're doing a number of public engagement events, including talking to schools through British Science Week, for example. To talk to children of different ages, both primary and secondary school children. We work very closely with the Great Ormond Street Parents and Carers Group and Young Persons Advisory Group. So they've been involved from the start, really. And so, for example, we had an A-level student from that group who helped develop our comms strategy when we were writing the grant. The young people helped us pick the name of the study because we had to change it, and they also helped us with ideas for the logo. So we're meeting them again to discuss the public engagement strategy. So we're working with them a lot. And that's all I want to say. And I'm sorry I talked for ages. I can talk for a very long time about this, but these are just some questions for you, but I'm sure you have loads of questions anyway, so please fire away. But I'd love to hear what your thoughts are, yeah, that's all I wanted to say.
Yeah, thank you. That's a really good run through, and in fact, just before we go to the questions, you mentioned the Born in Bradford work.
Yes.
With Samina. I didn't know whether you want to say any words, Samina, about what Born in Bradford has done over the years, because that's long established, isn't it?
Yes, hi everyone. My name is Samina, and I've been sort of involved in the Born in Bradford, one of their cohorts. So Born in Bradford was originally from, I believe, 2006, but the cohort that I was involved in started in 2016. 2015 was when Bradford got the 10 million lottery fund, and that was because of the deprivation in Bradford, and it was one of the 5 chosen sites for children's outcomes and health. So that's the cohort that I've been involved in, and I don't know if you want me to talk a bit about what the project was and how Born in Bradford and Better Start Bradford were going to do the database and collect all the data. Yeah. So you might ask why was Bradford? It was actually 3 wards of Bradford that were quite, there was a lot of poverty and deprivation, and there was poor housing in those areas, as well as the health inequalities were showing that for families were poor outcomes. So that's why they were chosen. But what Born in Bradford and Better Start did was that Better Start Bradford set up 22 projects looking at addressing early years development, and that was from when I got involved, as I was a parent, so I got involved in some of the projects, and so my daughter accessed those projects as well. So she's like been on the journey of that since 2015. So yeah, so some of the projects that they were looking at, the main areas was children's social and emotional development, communication and language development, and nutrition and obesity. And one of the projects that I got involved in was called the Henry Programme, and it was an 8-week programme which looked at healthy eating behaviours, nutrition and exercise, and that included how does the whole family get involved in doing that. And once the parents had done that program, it linked on to cook and eat sessions, which then looked at accessing food and things like setting up classes to cook and eat, because a lot of parents needed help with budgeting and how to cook. And also one of the things about those sessions was that you would then get the children involved, the young, in the early years, and get them with cooking with you as well, and then sitting down at meal times. So it was looking at the whole family dynamics and the setup of the family and communication. The other project that I was involved with was perinatal support service, and that worked with women who during pregnancy or in their first year of pregnancy who had social, emotional and needed practical help. And I became one of the volunteers on that. So I was then supporting mums, helping them to reduce isolation and just really be a befriender, so that they could talk to things like, how do you, communicate with your baby when they're born? How do you do attachment? Excuse me. So things like that. Now, the other thing that I was also involved in was Better Place, which looked at these three Better Start Bradford wards were, there was a lot of deprivation, and there was hardly any, well, there were green spaces, but they weren't usable. And there was a lot of crime around and vandalism in the green spaces. So what Better Place did was they worked with local parents, and they supported them to start improving the green areas, and also with the local council and another organisation called Bradford Trident and Groundwork. So things like putting in play equipment, and getting parents and toddlers involved in planting, flowers and other trees, things like that, so that they were then going to be able to use that. But also working with the local authority to make sure that families were safe going there, and things didn't get vandalized. So these community groups and parents, one of the things was, it wasn't just about going to the local parks and getting involved in there and improving the areas and making them safe as play areas. It was also about looking at streets and what people could do, what parents and families and communities could do in their own street. So it may mean there was a piece of land there, green space, and parents could then start take that over and start improving it. The impact it had on a lot of parents and community was that they got a lot of use out of it. And what the local authority did was, then we got funding and we were able to put in the sort of gym equipment in the parks. So you had parents accessing that, families, but you also had things like tennis courts, and you had football play areas. So it was about getting the whole community involved. Now, as Pia mentioned, a lot of this, what Born in Bradford had to do was to get the data for all of this, to see how it links in with improving healthier outcomes for children and families. And one of the things that we found difficult was each of these 22 projects needed to collect data, and the data had to be not just for the National Lottery who funded, they needed the data and the outcomes, but also Born in Bradford, so that then they could follow the journey and link the data to routine health records, and right up to when children go to school as well. Now, a lot of these projects were in areas where there were a lot of South Asian population, but also a lot of Eastern European. And when it came to about filling forms in, so, about things like, asking about, what your income is, what's the makeup of your family? Do you live in an extended family where you have elderly people there? And it was really difficult because a lot of people didn't want to give that information. And some people didn't give it because they didn't know. So it may mean that the partner managed the finances, so they didn't really know what benefits or what income they were getting. So there was a lot of difficulty at the beginning, but it was hard because the projects depended on collecting this information so that people could access, getting involved in each of the projects. But we had what was called a affairs team, and they were community workers who then worked with community groups, and because they spoke bilingual languages from those communities, they were able to then explain, why this data was needed. And a lot of people then started giving their data, and they felt that it was going to be safe, and they knew where it was going to and when it would be used and anonymized. So that was the general overview of Born in Bradford, and it's due to finish in 2025. And what will happen is this data will then be used to not just for Bradford commissioning services, but also for other local authorities who may want to set, projects up, and then this data can then be used for them to, commission those services across the UK. And I suppose the final thing I wanted to add was that it's been a learning journey for me, because what happened was when this was originally set up, there were the projects that were originally designed in 2015 had to be adapted, and that had to be to meet the population need and the ethnicity and the general makeup of the public. But they were sort of redesigned. But the other thing that came out of that was we had what's called a Happy Early Years Fund. So we didn't just have those 22 projects. Parents could then go and bid for monies to set up a group, and that could be parents getting together and saying, well, we'd like to go and do activities, and we want to go swimming and take our children to swimming because there's no facilities for such swimming with the local authority, and we can't access them. So they were able to bid up to 2,500 and use those monies to then, participate in that activity and use the monies for over a number of weeks and help with transport and paying the costs for the swimming sessions. And again, that data was again being collected by Born in Bradford, and it was going to look at, what's the impact of, children and families, and it even followed through. Did mums go on to go and do other things like do English classes, or did anybody go into further education, or did the parents go into employment? So it was like following the whole journey of, what's been, how this fund helped, parents, get access to services in the community. And it was a lot about what was relevant to them. So it wasn't services coming in and saying, we're going to set up a group. Parents were taking the lead, and they were setting up the activities, and and the groups really to improve their health outcomes. Right, so I'll be quiet there. I've gone on a bit, and I'll let people ask questions if they want. Yeah.
No, Samina, I think it was a really good add-on to what Pia has said, because what I think we've heard, and I said this was a bit of a different education session, was the opportunity to link data at a national level and learn new things. But what Born in Bradford has demonstrated over many years, and has led in so many areas, is how to implement change and impact by using these data philosophies, but actually make impact on the ground. So using the data, the results, the analysis to do stuff as well involving communities. So I think I'm going to go to some questions now. The first one who managed to put his hand up was Pete Wheatston. Pete, shall I let you head off first?
Good morning. Can I do 4 questions in one, Chris, or do you want to?
Go on then.
Okay. Yeah, thanks, Pia and Samina. Really interesting. The first question I wanted to ask was about the data. How are you collecting some of this data, or intend to collect it? So things like temperature and how well ventilated the home was. Is that going to be qualitative or quantitative?
Yeah, so no, it's not qualitative. So the Met Office holds temperature data. So we've been talking to them about, they have various temperature and meteorological indicators that can be mapped.
Oh, that's external temperature. What about internal temperature?
Yeah, the internal temperature. So we've been using energy performance certificates for other studies. So these are the certificates. I don't know whether you've seen those, but anytime a property is let or sold or has certain upgrades done to it, there has to be a surveyor come and do energy. So that's quite that gives you indications of how energy efficient the home is. For example, has it got double glazing, etc. And then we've been working with, for other projects, we've been working with buildings engineers who can then use that data to model certain things. So you could potentially model the probability of mold in the home, etc.
Yeah, okay, thank you for that. Second question was Data Access Committee. You talked about lay membership, which is excellent. My question would be, how diverse is that lay membership and how many people?
Yeah, so that's what Exactly, that's a very good question, and I'm meeting. So I can put, there is a link to the research accreditation panel on the website. I can put on the UK Statistics Authority website, who work with ONS to run this panel. So I'll put that on. I can put that in the chat. But as I said, I did ask exactly those questions, and that's why I'm meeting with them on Monday. So
yeah, and I meant diversity. Yeah,
Sorry?
I meant diversity in all its dimensions, Pia. So, for example, one thing that struck me was this, at the moment, comes across to me anyway, and I suppose I've got a bit of a bias living in the north, as a very London-centric thing. Because you mentioned the Bloomsbury Festival. Well, you know, that's immediately one I thought of as a Yorkshire person. Let's nip down to Bloomsbury. So there's I put it as a challenge about how you can get something from UCL accepted much more broader geographically, let alone in all its other dimensions of diversity. And I think
just to say, I'll raise that with them on Monday. That's a really good point.
Yeah, if you've got somebody from the north on that panel, for example,
you want me
might
to
be
answer
helpful.
how we're trying to make it less London centric as well?
Yes, please. I'm going to shut up.
I've been I do know this. And we are, so for example, I met with Jennifer Preston at Liverpool, was the last week. She runs the network of young people's advisory groups across England. So we're hoping, for example, to go to Liverpool to talk to their YPOs, but she's going to advertise this throughout the whole country, so we can go there. I've been trying to get together with a group in Bristol called We the Curious. So they run quite a lot of public engagement events there. So we are trying. Yep,
and there's practical budgetary constraints there, but it was just the challenge I wanted to lay down. Third one was about, will you have a data access register published that the public can access? Sorry,
did you say data access register? Yep. Yes, we will. Yeah, that's one of the requirements of the funding, in fact. So yeah, it will be probably hoping ONS will have it on their website. We certainly have it on our own website, but we want ONS to have it as well. Yeah.
Cool. And it's about people being aware of A, it exists, and B, how to access it, I think. And the final thing, which is something Chris alluded to, and I picked it up from Samina's comment about how you convert research into impact on important things that's on these subjects. And so my question would be, so what? You've done the research. Who's going to pick that up and run with it? Now, I know sort of it plays into the political piece, but not all of it does.
Yeah, no, exactly. So I started this because I'm running a project on air pollution, housing, respiratory infections in children, and it took us 5 years to get access to the data. So that's why the necessity of this. And so through that project, for example, we're working with quality team at UK Health Security Agency. So they then feed into a Department for Education, Food and Rural Affairs, and their evidence about air pollution. It's very hard, and I've talked to various organisations like Mums for Lungs, for example, and they were quite keen that I should be more of an activist rather than a researcher. So it's difficult. We do try. So with this project, for example, we've been talking to policy teams in Department for Transport, Department for Education, Department of Health and Social Care, Natural England, UK HSA. How you actually affect change is difficult, but I feel like we're talking to the right people who are interested in this area, and they're interested in how evidence can be used to inform policy. But then I think it's a political question, unfortunately. We're also trying to make inroads more into local government as well, and working with some of my colleagues who work a lot with public health teams in local government, because they want to evaluate stuff like lower traffic neighbourhoods and things. And
I think I'll just jump in there, just put a couple of comments in. While I'm doing that, Pia, could you just stop sharing your slides, and then people can see everybody else's faces? The question about whose responsibility is it to turn research into real impact? Is it the researcher's job? By and large, researchers get funded to produce the research, and then somebody else has to pick it up and turn it into reality. I think Born in Bradford took it the other way around and started with a problem and worked with their localities to deliver the data, deliver the research, but for real impact. But it's a real problem that we get lots of research publications being published, and that publication is seen as the end point, the mark of success. Whereas what we all say is we need things to change as a result of the research. It's a general issue. The other point I was just going to mention that Pia said there was, I think you said it took you 5 years to get access to the data. So whilst we can look at this and Born in Bradford and say these are two good examples of using data for real impact, behind that, we collectively still have a job to make more demands of those people who hold and safeguard, potentially overprotect our data and other data, to make it easier for researchers with bona fide researchers with the appropriate backing, the appropriate ethics and all the security in place to be able to do their research more quickly rather than having to wait 5 years for the data to arrive, because we've seen too many projects not even starting because they can't get access to the data and just frankly giving up. So that's just a reminder to us all, that's part of our job, our continued lobbying to try and make data access more smooth for researchers. So enough of that, me talking. I'm going to go to the second question, which came in on the chat, which was from Paul Saunders. Question for Pia: how do you deal with the issue of third factors? By this I mean good environments and how this is good for health, but better education generating better income and making it easier to choose the areas to live. So education mobility is important, correlation versus causation. Well, you're such a bright guy, Paul. I'm glad you wrote that because I could never have said that. Yeah, I don't know whether you want to pick that up. That is in the chat for you to see.
Yeah, I mean, absolutely. So yeah, as an epidemiologist, we think a lot about reverse causality. You know, the way I'd say, so we're setting up the cohort. I obviously have interest in using the cohort for various research, but the idea is that we're setting it up so that researchers can use it to look at environmental health, environmental impacts on children's health and education. I feel like I shouldn't tell them how to analyze the data. They will have to get funding for it, and they will have to, in their funding applications, justify how they're going to look at these very interlinked and challenging effects. And like, yeah, so one obvious one, like we just said, that we encounter a lot is if you can afford to live next to a park and on a very busy road, obviously you're going to. And so we, so there's various statistical methods to deal with that. One thing that we've been exploring that you can do it with the type of data that we're setting up is to look at sibling control studies. So when you look at siblings who one was born, say, in city centre, very polluted, and then our second one, they move out, the parents move out to like the countryside. It's the same parents, everything, you know, within the family probably very likely stays the same, but the environment in which the child, you know, the mother, the exposure of the mother during pregnancy was very different. And so that could be a way, but as I said, it's up to each research. Like, I'm not going to dictate how they should analyze the data, but they will have to justify those things when they look for funding for the research accreditation panel, etc. Yeah,
which is why it's really important to get lay members, bog standard boring people like us, on the assessment panels to make the decisions rather than being made by researchers. Thank you. There's a question in the chat, and then Victoria's got a hand up after that. So the question in the chat came from Richard Stevens, who is a former social housing manager and school governor, so he's very keen on this. And he said, well, you can read the thing in the chat because it's quite long. For question 3, I suggest there are 3 strands to the work. The challenge we all have is that we want and deserve evidence-based policy. I think this comes back to the point about, so let's ask you directly, you're a researcher, Pia, but do you find that your job tends to finish when you produce the research? Because I've talked to lots of researchers who feel they're not encouraged to turn their research into action.
Yeah, no, I try not to do I try not to do that. So some of the work we do is quite technical and methodological, and then we sort of the main audience perhaps is other researchers, but we try not to do that. So that's why, yeah, we've done a lot of connections for this and for other projects. I can put the link to the other project I'm doing on air pollution and respiratory infections. We're really reaching out to policymakers. So, for example, we had the head of air quality UK come to one of our meetings for that project. And Administrative Data Research UK are really keen to sort of for us to talk to policymakers as well. I mean, we tend to talk a lot to the analysts and the civil servants. I have had meetings with politicians, but I'm not going to say who, but or yeah, I can remember. So yeah, I've had that as well, but that's been very much as a sort of as a scientific, giving scientific advice.
Yeah.
I'm part of something called the Children's Policy Research Unit, and there we work, we have meetings with, again, it's analyst teams at the Department of Health, but I feel like we can also, yeah, it's basically extremely difficult, Chris. I don't know, but
yeah.
we are trying, but it's very difficult also to measure from our side, like what we do has then what has actually happened as a result of what we've done.
And I think part of today is to the people on this call can see what opportunities there are to use data like this and have an impact like we've had in Bradford over many years, to go back to their own communities as well and ask the questions. Victoria, you've very, very patiently waited with your hand up. You want to unmute yourself and then?
I am. Okay.
Yeah.
Yes, it's nice to see everyone and to be hearing some of the activities that one was involved in as a public health worker, nutrition-based. And it occurs to me that an approach that may work is the problem-solving approach. Instead of research I want to generate, you look for a problem, identify, and then try and solve. And in the process, develop your own database and possible solutions to solve the problem. And then those with advanced knowledge in research, etc., can, have something to work with. Because when I did my master's at Maastricht, the approach was problem solving. You go develop your solutions for something that is causing problems. In my case, we applied mainly to development of primary health care, because healthcare was based very posh at the top and very scanty lower down. And we needed to improve the very rudimentary services at the outskirts, peri-urban and rural. So it's not just rural, it was the peri-urban areas, because you would think that if you are within a developed part, then those problems may not exist. So the problem-solving approach, I think it could work, because you generate your own information by doing the usual gathering of data to know the place you are working with, identify the very vital points that are relevant to the community. So community involvement is very paramount, and you get them to bring out their ideas, and then you work out a strategy. So I don't know if that sounds like something that's already being done, but called a different name.
I think you're right. I've seen a few big research programs that have come up with a solution looking for a problem, where actually you're saying start with the problem first. I think that's exactly what one in Bradford did many years ago, and has developed over time. So if you're not if you've not read about the Born in Bradford work, it's worth looking on the website. In fact, if people want to, we could even do a full session on Born in Bradford as a regional example of where you start with a problem, you work out what you need to understand to do something about it, and then you do something about it. So it's a really nice start to finish program because it's been going for so many years. But I'd agree. Pia?
Yeah, I was just going to say, yeah, absolutely. I think what some of you know, and Victoria, like what Born in Bradford, I'm a massive fan of Born in Bradford, and I was just saying to Chris and Emily that the director of Born in Bradford, Rosie, is the chair of our scientific advisory group. Just in terms of Victoria, one of the things in our, like a key thing in our public engagement strategy is to get young people to suggest research questions so that we can have a list of research questions that they prioritize, so that we can, when people apply for funding or they want to use the data, we can say, okay, but this is what young people and parents, this is what they find are the most sort of pressing questions that they want answered from the data. That's the sort of, in terms of the problem solving approach, I think we really want to make that a key aspect of this.
Okay.
Yeah.
Thanks. I'm conscious of time because we're now at about 1 minute left. I hope that was an interesting session. It certainly has been. Pia, thank you fantastically for everything you've done there. Alistair, sorry we didn't get to you, but you know, we knew you were there. Samina, similarly, really nice quick intro to Born in Bradford, and I think Richard Stevens has put something in the chat saying, yes, let's have a session on Born in Bradford, particularly where data has been used to change things and how citizen involvement works. I think that'll be a good one to look at as well. And with that, I'd just like to thank everybody for your time and energy. I hope this was another useful session. We try and make these things, lots of different topics, quite different, quite varied, and quite interactive. So that it can feel a bit frantic, but I think today we've seen another really good example of national level work, the problems and the opportunities and the doability of some of this thing, alongside some of the really localized work that is adopting the same principles with the philosophy of getting things done. So I think, unless anybody else has got anything to say, no. Thank you for everybody who's contributed to that. Thank you for everybody for turning up. We'll put, oh, Victoria, have you got your hand up again? Nope. We'll put the recording of this session up on the website for you to rewatch again. We'll put it out in the newsletter for people to watch who couldn't attend today. Lots of people wanted to attend but couldn't. And we'll also keep involved with all the other education sessions that Emily kindly puts together. So last thanks goes to Emily for organising all this. It takes a lot of time and energy, so thank you. And with that, I'll say have a lovely, hopefully dry weekend. Enjoy the weather, and we'll see you again at the next session. Okay, thanks everybody.
Thank you so much, everyone. Lovely to meet you all. Thanks. Bye.